A short update from me on activities from the Sunrise Europe group in the past kind of 12 to 15 months or so. We've had a small number of in-person and online meetings in that time, and like before, we've been discussing common problems, particularly recruitment and possible solutions to those problems been discussed. Some of the countries have added some measures, so we've been having a few discussions about some of those things, what to add, how to measure it, so on. We've been doing a bit of advocacy in writing, and I'll summarize some of that in a moment. Grant planning, we're kind of on standby. There really have been very few suitable opportunities, but we have been keeping an eye on those. Research and mobility is something we're very open to across the Sunrise Europe group and beyond, indeed, to other Sunrise countries, but not much of that to report at the moment. This is our main advocacy effort since the last AGM. So this paper published in Lancet Regional Health Europe. It's open access and it was published in the April issue. And really it was partly an expression of frustration at the lack of impact of the guidelines published in April 2019 over that 5-year period. So what we did in the paper was effectively ask whether countries in the WHO European region passed these 3 tests. A, did they adopt or adapt the guidelines? Do they have surveillance in relation to the guidelines? Do they have specific policy in relation to the movement behaviours in the under 5s? And the answers to those questions are summarised in the 3 figures, and green would be what we're looking to see. This was intended as a kind of traffic light figure, but we had some green, but there's not very much green. So countries in Europe have generally not adopted or adapted the guidelines, don't have suitable surveillance, and don't have specific policy. We added an infographic to the paper for a number of steps which might get us from where we are now to where we should be in relation to proper impact of the guidelines across WHO Europe. There have been a number of challenges, I think, to Sunrise Europe progress. The main one, as always, is lack of time. I think everyone involved is busy. It's hard to carve out the time to have meetings, to discuss things, to follow those things up. The countries themselves are at very different stages of Sunrise. There's still lots of potential, I think, though, including spin-off studies, which some of the countries have now started. So, for example, these are studies that are aligned with Sunrise, make the Sunrise protocol measures, but may answer different research questions and may have additional measures to answer those. Grant writing opportunities, we remain open to those, and hopefully one will come along one day, which is very suitable. There's lots of potential, I think, for additional analyses and subgroup analysis, and that will grow as the amount of data in the Sunrise Europe study grows and the countries progress from pilot to main studies. Loads of potential still for researcher mobility and for more advocacy as and when that is required. That could be mass media, for example, or it could be advocacy with the WHO office in Europe. And there's probably lots of other potential things we might do if we only had the time, and maybe we should be focusing on in future. And that's one of the things we'll be discussing in this meeting.